And our first one is Say No to Multi-Resistant Organisms.
Prior to December 2014, the Critical Care Medicine Unit at the Sutherland Hospital was experiencing MRO acquisition rates of 15.7 per 1,000 bed occupied days, which was well above the state benchmark of 2. We were putting our patients at unnecessary harm and risk. These rates were due to factors we couldn't control, such as the unit design, inadequate isolation rooms and cohorting of patients, but there were factors we could control. We implemented a multifaceted project which included use of PPE for all patients, strict hand hygiene practices, isolation zones and single-use items, as well as changing an organisational culture through education, leadership and vigilance. We performed scheduled environmental cleans and a deprox clean of hotspot areas and had a zero tolerance approach to any member of the organisation that failed to comply with the project. Yes, even the really cranky ones. These projects had resulted in...
Thank you very much indeed. Second in this section is Partners in Improved Development Outcomes, South Western Sydney Local Health District.
This project showcases the joint collaboration between South Western Sydney Local Health District and Thurroll Aboriginal Medical Service to deliver community-based allied health services to Indigenous children residing in the Campbelltown local government area. Longitudinal research in this LGA has identified delays in Indigenous children's development across a number of developmental domains at 3 years and prior to school entry in comparison to their non-Indigenous peers. Allied health staff and Thurroll staff work in partnership to provide access to culturally appropriate, community-based allied health interventions encompassing speech pathology, occupational therapy and child psychology, which are delivered in the Thurroll Aboriginal Medical Service as well as Indigenous daycare centres. These services are closing the gap in Aboriginal health outcomes by focusing on targets that predict later academic success at school. Positive outcomes have been identified in children's development in pre-literacy and language, social and emotional regulation, fine motor skills, all of which are necessary for future academic success.
Right bug, right drug, every patient, every time. Central Coast Health, Local Health District.
Throughout the world, antibiotics are losing their effectiveness and people are dying from previously treatable infections. There are a few new antibiotics being developed, so we really have to preserve what we have. Antimicrobial resistance has been recognised as one of the greatest threats to human health, and last month, global leaders met in the UN General Assembly to commit to united action. We found that at the Central Coast Local Health District, we were using more antibiotics than compared to similar hospitals, and a lot of prescribing was not compliant with guidelines. With this project, we set out to improve antibiotic prescribing with the ultimate aim of improving patient safety and preserving antibiotics. The program involved a number of different aspects, including the need for approval to use protected antimicrobial agents, antimicrobial stewardship ward rounds, the development of guidelines and education programs. Since implementing the program 18 months ago,
and
we have
just
halved
at the point of suspense, we lose it. I hasten to add that the details of these finalists are available outside. They are all fantastic projects. I'm just having fun with you, but really important projects, and antibiotic stewardship is not the least of them.